Hi, I'm Dr. Jenn Kennedy, sexologist, couples therapist, and host of Pleasure Project. This podcast is all about sex, relationships, and the complicated and fascinating space where they collide. We talk about desire, connection, dysfunction, communication, exploration, toys, trends, and the things people usually are thinking about, but not always saying out loud. Some episodes feature leading experts, and sometimes it's just me and honest conversations with you. Either way, the goal is simple: more insight, more connection, and more pleasure. If you enjoy these conversations, you can follow along on Instagram, TikTok, YouTube, LinkedIn at Dr. Jenn Kennedy, or visit my website at drjenkennedy.com for even more resources and conversations around intimacy, relationships. Male enhancement is one of those topics that many people are curious about, but few people openly discuss. As the industry continues to grow, so do questions about body image, sexual confidence, safety, and the messages that men are receiving about their bodies. Today, I'm joined by Dr. Joel Pash, co-founder of the Upsize Clinic, and a physician who has spent years helping men navigate concerns related to sexual confidence, body image, and enhancement procedures. In this conversation, we're exploring what's driving the rapid growth in this industry, the emotional factors that often bring men through the door, the risks of an increasingly unregulated marketplace, and what men should know before making decisions about their bodies and sexual health. So tune in. So today's guest is Dr. Joel Pash, who is the co-founder of the Upsize Clinic and medical director of the San Francisco location. Dr. Pash is a board-certified physician who pursued a residency in anesthesiology. With 2 decades of practice, he has performed thousands of advanced injectable procedures, including nerve blocks, spinal injections, vascular access procedures, and penile injections. Dr. Pash developed the proprietary Upsize technique that has revolutionized the non-surgical penis enlargement, which we're going to discuss today. So we're also talking about the growing world of male enhancement, why demand is rising so quickly, what men are looking for, the emotional and psychological layers underneath these procedures, and the very real risks of increasing unregulated industry. We'll discuss body image, sexual confidence, shame, misinformation online, and how men make informed decisions when it comes to their bodies and their sexual health. So welcome. Glad to have you here.
Thanks for having me also.
Yeah. So why do you see this big boom happening in this industry? Like, where do you attribute the influx of interest in this area?
It seems like men's health in general is having kind of a, I don't want to say resurgence because I don't know that it existed before, but men's health in general seems to be big right now. And,
Mm-hmm.
and those are things like hormone replacement and weight loss and fitness and biohacking and all those kind of things. And so I
Yeah.
think this male enhancement kind of fits into that, just making yourself better in whatever way. And then we hear a lot that a lot of guys look into this because their partners or spouses or whatever had some sort of procedure done, whether it's lips or breast implants or butt lift or, liposuction or any of these things. So those are obviously common and have been common for a long time, but I just think it's kind of time for men to have their thing now.
That makes sense, right? It's like she's getting it done. What about me? And yeah, I know HRT has been on the uprise with women, and testosterone is also starting to be a bigger conversation amongst men as well. What do you think men are really seeking when they're looking for this category of enhancement?
So there's a misconception, I think, that guys that see us have small penises in the first place, and that's actually
Mm-hmm.
not the case. By definition, by definition, most people are average, right? And
Mm-hmm.
there's nothing wrong with average. And I think most guys that see us are kind of curious as to what life would be like if it was larger, but not
Yeah.
necessarily lacking confidence with what they have. It's probably very analogous to breast implants.
Yeah. Right.
Most,
There's always been this curiosity about how it would be to have it be augmented.
Yeah, like women are like, oh, that would be awesome if I had breast implants, but it's not like they're walking around with lacking confidence or anything like
Hmm.
that, or at least that's not my impression that I've gotten.
I don't know. I do feel like men have more, they place more value on the size of their penis versus women and the size of their breasts. Do feel like there's a little bit more, and I think it's more men amongst men versus women amongst women. I culturally, I
Right.
just do feel like there is a little bit more.
Well, yeah,
I don't
women
know.
don't care, right? Like as long as you have a normally functioning one that's, a normal size, women don't care. But I would
Hmm.
say it's the same for breast implants in the sense that most men don't really care, right? As long they might like joke around and say they care, but I don't think the size of your breast is going to make or break a relationship or anything like that. And
Hmm.
I think the same with the penis, although what men think they need or what women think they need is probably vastly different than what you
Yeah,
actually need.
yeah, right. There's function and then there's fashion, I guess.
Yeah,
Right. There's how it
exactly.
looks and how it works.
Right.
Yeah. So in terms of, well, first of all, let's talk about what is normal. Like, because there is a huge range. What is a normal size penis size range?
If we're talking about length,
Hmm.
it's flaccid, something like 3.5 inches, and erect, something like 4.5 or 5 inches. I could be off by half an inch or so.
Hmm.
And girth is flaccid 4 inches and erect 5 inches.
Okay.
The girth circumference is deceptively bigger than what, like the amount of inches I'm saying sounds bigger than what it is, right?
Hmm.
Like people think 4 inches and think, oh, that's massive, but it's
Yeah.
circumference, right?
Yeah.
So
Yeah. Okay. Yeah. When you lay that out, that sounds big, but like, yeah, when you
it's
lay it
because it's
out.
wrapped all around, right? Like really guys are
Right.
probably thinking about diameter when they
Right.
think of how big something is. And I forget my geometry, but I think that
Right.
it's
Right.
like,
Radius.
well,
Well, and it's
radius is half
also,
diameter, but yeah.
if you think about the rise of porn and, of course, comparison to people online and the people that have made it to, I mean, not the home photography, but more the ones that have made it into good porn, they're exceptional. That's why they get to have those jobs because their bodies and their enhancements are different than the average, right? They're on
Right.
the high end of the scale, or maybe they've had enhancements too, but typically they're just,
Yeah, they're always above average to start with,
hmm.
and then some of
Yeah.
them do come see people like me. But
Hmm.
you're absolutely right. Like you can't compare yourself to people you see in porn. Just like I'm a guitar player, like I can't compare myself to, Kirk Hammett or James Hetfield or Eddie Van
Yeah.
Halen or one of those people. It's not it's
Right.
not it's not reasonable.
Yeah. Yep. And so also it's interesting because, well, I see a lot of men in my practice who are older and their functioning is starting to wane. And so they're having issues with not just achieving erection, but maintaining erection. And so there's just a lot of shame. There's a lot of psychological stuff tied into, my manhood is tied into my erections and my size, my shape, my erections matter, and it really seriously impacts their sex life in terms
Yeah,
of
so that's I
how
would
they
say a
feel.
different category, right? Because now we're talking
Hmm.
about actual functionality.
Functioning. Yeah.
And that's a different treatment. At our clinics, we have treatment for that also.
Hmm.
But I would say that's a totally separate thing in the sense that if we're just
Hmm.
talking about enlargement, that's purely cosmetic. There's
Okay.
no scenario where that's not cosmetic. And then if you're talking about ED, that's even functional enough that it's usually insured, for example. Now we don't do things that are insured because you can just go to your regular doctor for that.
Hmm.
But we do have treatments for erectile dysfunction. Like one of the things we do is Botox injections, which is off label,
Mm. Hmm.
but
Oh,
we
I didn't
don't.
realize that that was helpful too. Okay. Boy, Botox is good for everything.
Yeah.
It's good for
It's like
headaches.
headaches. Right. Your
I know
face,
it's good for
your
sweating.
penis.
I
Right.
know it's good for your penis. Yeah, okay. Do you find that enlargement happens for the most part for men who are partnered, or typically men who are single that are looking to find a partner? Like, where are they in their trajectory of
It
that?
really has, there's no correlation. Like, I'm thinking, if I think about the patients I have, most of them are in a relationship, but I think most people are in a relationship anyways between the ages of 30
Mm-hmm.
and 70 or something. So
Mm-hmm.
it's certainly not a thing where just like single guys that want to have sex or, want to be promiscuous, I should say, or looking at.
Mm-hmm.
It's definitely a normal segment of the population.
Yeah. Yeah. I just wonder, this is something that they've been sort of brewing on and deciding, okay, so this is something like, and they are discussing it with their partners. Do their partners come in for the consultations often?
So, well, not usually. There's a there's a whole gamut of reasons and like different examples of people that come.
Mm-hmm.
Most guys like tell their partners and come, and it's all normal. There is a lot of guys though that hide it from their partners, like presumably
Right.
because they're either embarrassed, or I think a big one is they feel that their partner is going to tell them it's a waste of money or they don't need it
Mm-hmm.
or something like that. And
But then
then,
it's just like surprise.
well, there some, yeah, I mean, being a married guy to kind of what I consider to be a relatively normal woman, I think she would not consider that to be a great surprise if I did that.
Right.
She would probably have wanted me to talk to her about it, but yeah, guys are like, I mean, I've heard things as crazy as like, I'm surprising my wife with this for her birthday.
Right.
Like, yeah, you might want to do like some jewelry or something like that, but
Right.
guys have crazy ideas of what
Yeah.
of the reasons why they do stuff, obviously.
Right. Yeah. It's like the gift that just keeps on giving.
Right. I
Right.
mean, you could look at like all
Mm-hmm.
the things I've done with my money and in my personal life, and you'd probably say they're all
Mm-hmm.
crazy also, right? So this
Right.
this is just like one
Well,
more
and
thing.
it's interesting because, I mean, there's many things that men and women do for enhancement and image, from waxing to hairstyles to clothing to anything could be arguably discretionary. So if it makes you feel markedly better, then is it worth it? Is this something that's going to build confidence and make you show up differently and better? Is it going to then have a relational benefit that's going to, make your sex life better?
Well, I think in almost all cases, it makes you feel better and makes your sex life better. The question we're talking about is whether they're comfortable enough telling their partner in
Mm-hmm.
advance, or whether they think their partner is going to talk them out of doing it. There's all kinds of reasons, right? Anywhere from it's expensive and I'd rather you make the car payment to the guy just
Right.
being embarrassed. Like, because guys don't really talk about this stuff as much.
Mm-hmm.
It's very normal for not, normal is maybe not the right word, but women, like if a woman goes and gets lip injections, for example, no one's
Mm-hmm.
even going to think twice about that. No one's going to say anything. You just assume that's a totally normal thing. Guys that get their penis injected, I think it's a normal thing. I do it for a living, but I think a lot of guys, like, they maybe don't know anyone that's had this done yet, and
Mm-hmm.
it's something they've never, like, guys have never had to talk about these things with their partner because
Yeah.
they haven't been getting it done. So it's just a different.
Well, but I will say I code it differently on my joint calendar so that my spouse doesn't know that's what I'm doing when I get like Botox or something.
Right.
I put doctor's appointment and I
Well, you're
hide
not
it a little
lying.
bit.
Right.
It's there, but yeah, I understand the expense part is like, well, so, but yeah, culturally, it's like, is this expense, justified? And there is a maintenance element, right? It doesn't last forever. It's not like a
Right.
tattoo where it's one and done. So there is a consideration in terms of ongoing spending. And so, some partner communication, if this is going to be a longer term partnership, probably is necessary and reasonable
I would say
because
so. Yeah.
it's I know typically it lasts what about 2 years, right?
2
If it's
years.
done well. Hmm.
I
And
mean,
so they're going to see a waning of it over time, and there's going to have to be a conversation when there's an if there's a second treatment or a third treatment down the road.
yeah, like on the one hand, I'm thinking my wife would definitely want a conversation before I got it done. But on the other
Hmm.
hand, I'm thinking she goes and gets Botox all the time and doesn't tell me about it. So I guess,
Yeah.
like
Hmm.
you said, you just get your thing done and it's between you. But,
Hmm.
it,
It isn't
it
built
can
into the
be
budget. Yeah.
right. It can be expensive, but it can also be a one time thing. Like, there's no requirement that in 2 years you come back and get it again. It might be that at this time in your life, it's a good idea. And in 2 years from now, it's not a good idea, or it could be something that you get forever. But it does have to
Yeah.
be something that you can afford, right? Like, we don't want it replacing, your car payment and your house payment and stuff like
Right.
that.
Right. Yeah. So there are lots of other places. We're going to talk about your process in a minute, but there are other places that are unregulated that are offering other things. What are some of those options that people should steer clear of?
Are you talking about like clinics that are not run by legitimate doctors, or are you talking about
Yeah.
pills and stuff, or just
Yeah.
anything?
What else is out there? Like if men are looking for enhancement, like what are things that they get snared into that are
Right.
not a good
Well, I'd say the
idea?
most common is pills, right?
Mm-hmm.
There's pills all over. Like, if you search for what we offer on the internet, like the first thing that's
Mm-hmm.
going to come up is all kinds of sketchy pills. And
Mm-hmm.
in general, pills, you don't know what's in them. They could be nothing, or the best case is they're not effective. The worst case is they have some drug in them that's contaminated, or that you're contraindicated to be taking, or that's just outright dangerous for anyone to take. So in general, that's the case with supplements. And we see that with people doing all kinds of other things like peptides, like, ordering them from non-medical places and stuff like that.
Yeah.
Then so I generally would tell people to stay away from pills that are not regulated. There's things like pumps and stretching devices. You can just order those. I don't think they're harmful per se. Whether or not
Stretching doesn't work though, right?
stretching might actually work, pumps definitely don't work.
I mean,
Stretching
skin,
can work. What's
yeah,
that?
I mean, when I think about it, I mean, I guess skin and tissue does stretch, but I've heard that it's really hard to gain any length.
Yeah, like you might gain a half an inch or three
Marginal.
quarters of an inch doing it for
Hmm.
a year or something like that. So, but
Hmm.
as some people say, every inch counts, or every centimeter counts, or whatever.
Right.
But you do see, like, so for some examples, if you take one thing I was thinking about the other day as an example, is those people get those like earrings put in that dilate that big hole in their ear eventually. You know what I'm
Yeah, ear
talking about?
stretchers. Hmm.
Yeah. So like
Yeah.
eventually you just have this big hole in your ear that's permanent. So in that sense, it has actually stretched something. There's in plastic surgery, like particularly for reconstructive surgery, they'll put spacers in. Like, say you have a mastectomy, they'll put spacers in to make space there. So again, they're stretching out skin, and that's permanent. So you can stretch the length of your penis. It's not gonna make you from like normal to like the porn star that you're trying to become, right?
Right.
It's just be
Right. And sometimes those kind of things kick off problems you didn't anticipate, right? Like it might look a little
right.
saggy or droopy or whatever in ways
Well,
you
yeah,
didn't
like if
necessarily
you add an
want.
inch, now you're like skinnier, right? So now you have
Right.
this like long, skinny
Right.
penis. Like it does. It's just like stretching anything's going to make it thinner. But
Right.
I don't think it's dangerous. Pumps, on the other hand, they're not really dangerous either. But what we see is that guys that use them, you can immediately tell because their skin's all discolored, and
Mm.
it kind of, I think what it causes like microvascular trauma, like it's just basically bursting blood vessels all the
Yeah.
time, and then you just get
Which
like
makes sense because
discolored.
it's forcing the
Yeah,
air in there and it doesn't get have a chance to stretch slowly. It forces it quickly.
yeah. So like I'll see someone, and in two
Hmm.
seconds I can tell like, oh yeah, been using a pump, right? And I'm pretty much always right. So that's a consideration. And
Mm-hmm.
then as far as procedures go, like honestly, it's not common that I see it's not common that I see or hear about unregulated, sketchy clinics, but I have heard of them. So they're out there
Mm-hmm.
somewhere. But it's probably just that the people that go to those are not ever going to see me. Like you, I think you have to have like some sort of level of IQ to know that you should probably find like a doctor or a nurse or a PA or something rather than like a back alley like hairdresser or something like that.
Right.
I think it just like selects for a different group of people entirely. Most guys
Yeah.
that come see me would know that you shouldn't go to someone that's not a doctor. Although there are it does exist. So whenever you
Yeah.
have any medical procedure done, make sure that they're qualified to do the procedure. They have a medical
Well, yeah, I
license.
mean, if you think about like the diet industry, there's just a bajillion people that are ready to sell you something. There always has been. And there's a lot of men in this world that would love to have enhancement. So I know that there's plenty of people that are willing to sell snake oil, in
Yeah,
every version. Yeah.
you'll see it in the news and stuff like that. I think it's
Mm-hmm.
rare, but it's certainly, and it's not only to do with enhancement. It's just if you're getting a
Mm-hmm.
medical procedure done, make sure that whoever's doing it is qualified. Even if you're getting a tattoo, right? Like there's licenses
Yeah.
I mean, I don't know. I'm not a tattoo artist, but I would imagine you need a license to do it, and they inspect your place to make sure it's clean and all that. So anything you get done, you want to make sure that it's legitimately licensed and the people are legally allowed to be doing it.
Yeah. Yeah. Any like fact versus fiction, like any specific myths that you feel like regularly come in the door? Like I know as a sex therapist, people come in all the time with the things that they think should be happening. Like, what about for you in terms of men coming in?
Well, the biggest myth that I'd like to mention is that this is not a thing only for guys with small penises.
Mm,
So it really isn't. Like most guys, I mean, we kind of briefly talked about this before. Most guys that come see me have normal penises. Some even have huge ones to start with, but everyone kind of wants whatever they have to be bigger.
mm,
Another myth is like we were talking about, the normal size is not what you see on like a video or whatever. And the last myth I think is that length is not necessarily the most important attribute, and B, that's a good thing because it's impossible to get length in any substantial amount added on. And so, to our earlier point or our earlier discussion about kind of like unregulated, sketchy things, you do have to watch out for doctors or clinics promising things that are not
possible.
likely to happen or that are not possible. So, you can be a fully qualified and licensed doctor, but still have misleading advertising or still
Sure.
outright lie to people, right? So definitely it's not possible to add length on to a penis. It's not possible to really make you taller by adding length onto your legs. It's kind of the same thing. It would just
Yep.
require an insanely complex surgery to do that.
Great. All right, we're going to take a quick break. And after the break, we are going to talk about actually how you do this procedure that you came up with. So we'll be right
Perfect.
back. Okay, so let's take a quick pause to share something I've been building that I think you will really appreciate if you're interested in sexuality, relationships, desire, and the deeper psychology behind connection. So, beyond the podcast, I create courses, tools, and educational resources designed to help people better understand themselves, their relationships, and the complexities of intimacy. Some are created for individuals navigating their own growth, and some are designed specifically for clinicians and helping professionals who want more nuanced conversations around sexuality and relational health. Everything I create is grounded in the same approach that you hear on the podcast: honest, psychologically informed, practical, and deeply human. So, whether you're here as someone who is exploring your own relationship to desire, or you're a clinician wanting to better language and framework for the work that you do, there's more waiting for you. You can learn more at drjenkennedy.com. If you're not already following us, come on over and connect with me on Instagram, TikTok, YouTube, and LinkedIn at Dr. Jenn Kennedy, where I share clips, insights, relationship dynamics, and conversations that don't always make it onto the episodes. All right, let's head back to the show. All right, so welcome back. So let's jump in and just talk about some safety standards. Specifically, what should men ask before they decide to move forward with this procedure?
The most important thing is, does the person that is doing the procedure have a medical license, or if they're like a nurse practitioner or a PA or something, the appropriate license? You want to make sure they've done it before, they've been trained appropriately. We do through Eurosculpt, which is our certifying agency, certified people to do it based on our
Yeah.
technique. But that's not the only way you can learn, but it's a good place to start. Then I would want to make sure that the procedure is done using sterile technique, because probably one of the biggest risks that they're, not that it's a risky procedure, but if I had to give a risk, it would be that an infection is possible, which usually isn't a big deal, but you don't want to get one and then need antibiotics and all that. So
Yeah.
those are, those are the big ones to look for.
And what is the role of anesthesia and pain management in this process?
The way that we do it, that I train people how to do it, we basically just numb the area that we're injecting, and that
Mm-hmm.
works really well. I've seen all kinds of other ways done, ranging from giving nitrous oxide, which is overkill, to doing penile nerve blocks, which is also overkill. But, I guess any of them are technically acceptable. It's just that the way that we do it works really well and it's very straightforward.
Mm-hmm. And then choosing the provider. So knowing that they've got some medical degree, knowing that they've actually done this before. Obviously, you don't want to be their starter person.
Yeah. I mean, you can be their starter. Everyone has to start somewhere, but
Somebody had a
I
starter
would be asking
person,
for a
but
discount or something, right? Like,
right. And are you seeing previous examples? Like, do they have photos that you're looking at? Like, how do you know? I mean, I know when you're looking at like getting a nose job, like, are you looking at samples? Like, are you looking at penis samples? How do you know what size is what you want?
yeah, well, that's what we have in our office is we actually have these sample size devices. Like, they're
Mm-hmm.
literally cylinders that come in different sizes, that like
Okay.
4 inches, 4.5 inches, 5 inches, that kind of thing. And so people can have an idea of what it is
Mm-hmm.
that we're offering. Now, everyone's anatomy is different. So just because you like the look of 5.5 inches, it doesn't mean you're going to get there, but
Mm-hmm.
at least you have an idea of what you're looking for, right? And so part
Mm-hmm.
of it is based on the experience of the doctor doing it. Like, if I've done over 1,000 procedures, maybe probably over 1,500. So I have some sort of ideas to.
Do you do you like okay, do you leave them in the room to like handle it? Like, do you go, okay, this is like realistic? Do you advise them based on their body size, what's reasonable for, like
Yeah.
how does that get sorted? I
Well,
mean, some women get breasts that are out of whack with their body and it looks absurd, you know?
correct. So some guys want it to look absurd, and you can do it. But most guys, again, just like breast implants, right? Like, if you want triple D, you can get them put in, but
Yeah,
you better just know that it's not going to look natural. And hopefully the
right,
doctor doing it makes that really clear.
right. It's also not going
So,
to feel comfortable for your partner.
no, well, right. So some guys, there's a few things. Most guys, like wherever they're starting at, you've got about
Hmm.
1.5 inches in addition before it can start looking, maybe 2 inches before it can start just looking unnatural. So
Hmm.
we'll kind of say, okay, this is where you're starting at. And here's all these examples of what a bigger size would look like. But you're the one on the left, the one like 10 down to the right, that's not realistic, right?
Mm-hmm.
So the kind, the ones that's an inch or 2 inches, maybe at most. So we'll just you
Mm-hmm.
have to be honest, right? And say, okay, this is your budget
Boy,
and this is the amount
right.
of
Oh
filler
my
you'll be
God.
getting.
You're literally having like these conversations about, and I just imagine like people with egos are like having like big dick energy like in the room, of like, I want the bigger one, Ugh, I've always wanted this.
Yeah, I mean, it's like part of my job and part of your job is just
Mhm.
being able to talk to people and understand what someone wants versus what they actually want is sometimes two different things also, right?
Yeah. Yeah.
Like we'll get phone calls and it's like guys call, they're like, yeah, I just want like 4 or 5 inches added onto my penis, right? And it's like in their mind they actually think
Right.
that is a
Right.
thing, but if you actually like take out a tape measure, that's absurd, right?
Right.
So
Yeah, well, and also when I think about too those women that have had, or men that have had massive like weight loss surgery, and they're still not happy because that wasn't the thing they needed. I mean, this massive procedure that changed their body, but it didn't address their psychological issues of worthlessness or insecurity or whatever, right? They still have to do some inner work
yeah,
often. So you
certainly
can't
that's a risk, right?
bypass
Like,
you can't bypass that
yeah.
part.
So
Yeah.
anyone doing cosmetic procedures should be kind of
Yeah.
thinking like, what's the reason for you getting this done? And are we
Mm,
likely able to, it's not common, but I've turned away a couple of people that's just like, no, that you're here for the wrong reason and this isn't going to help you
yeah.
achieve what you're looking for.
Do men usually make the decision like in a consultation? Like, do they know what they want, or do they like go away, think about it, need to see all the sizes again? Like, what's their process?
So we do phone consultations before we see the patients. So 90% of people that come to our office are ready to go and have a procedure done. We still do a full
Okay. Hmm.
consultation again, like in person, but we really want to make sure that before guys come to the office, they know the price, they
Yeah.
know what we can and can't do, and they
Yeah.
know that it's like not permanent and all those things. So like we're not getting guys in the office that want like 9 inches added onto the length of their penis. Like
Right.
we've already
Yeah.
eliminated that.
Screen them
So
out.
yeah, so like 90% of guys get it done right away, but there are guys that think about it, right? Like they, you have a real conversation with them and you're like,
Hmm.
no, what you think is like,
Yeah.
and like I had a guy the other day and he goes, his budget was like $4,000 or something, which isn't a lot, right? And he said, I said, well, we can do it, but you're not going to get the kind of result that you're looking for, right? And so he goes, oh well, but I'll still get, like, you mean maybe just the size of like my finger or something like that? And I'm like, no, your finger is like 2 inches around, right? Like maybe like 1/5 of your finger, So you get things like that, right? Where guys just don't really,
Yeah.
you have to see them to explain like what this
Yeah.
is.
Yeah.
But yeah, most guys are ready to go.
Okay, so walk us through your procedure. Like I know it's hyaluronic acid, right?
Yeah,
That's what's getting injected, which people are pretty familiar with in terms of that's in all so many of the beauty products now.
yeah. Well, women are familiar. Men mostly are
Yeah,
not.
yeah.
Yeah.
Women, I mean, I feel like it's in what I'm putting on my face every night, but what does it actually get injected into this to the skin, to the like where does it get injected?
Yeah, it's underneath the skin. So
Okay.
basically, if you think about the anatomy of the penis, there's
Mm-hmm.
the corpus cavernosum, which is
Mm-hmm.
where the blood goes. Like that's the functional part, right? And then what's surrounding that is essentially skin, right? Like you can pinch the skin on a penis, and it's like totally
Mm-hmm.
separate from the corpus cavernosum. So the filler is going in between those two areas.
Okay. Right, because there's a little bit of give in that area.
Yeah, there's a
Okay.
lot of give actually. If you're not erect,
Hmm.
there's a lot of give.
Okay. And you said you have clients that are everywhere from 30 to 70. So the age is doesn't matter. Like there's plenty of give, I guess, regardless of whether you're younger or older, and like there's plenty of because I
Yeah.
think of like older people having more skin and more, looser skin, but it doesn't matter even if you're a younger person. Like a 30-year-old still has enough room
Yeah,
to do that
like loose
comfortably.
skin is it could be difficult to certainly if you have like not good skin, which is as you get older, your skin
Hmm.
unfortunately gets not as good. It can
Hmm.
make it harder to do, but there's no I think what ends up happening is like our average age of people that come is like 35 to 65.
Okay.
And I think the people below 35 tend to not have as much disposable income. They're still either, like
Yeah.
18 or 19-year olds just don't have the
Yeah.
kind of money that you need to do these things. And 80, as 80-year olds still have lots of sex, but they not as much as like a 45-year
Hmm.
old or they're just used to what they've got and it's all good. So
Yeah.
I
Yep.
have had an 85-year-old patient though, so it's not
Yeah. I've had a
usually
few
not.
people in their 80s come in for sex therapy. I'm always
Yeah,
like, good, you're still
yeah.
interested in making this better. I appreciate that.
Well,
What
apparently, like
does
the biggest parties happening are at nursing homes, right? It's just like,
well, that's where all the STDs are
yeah,
flying. But
exactly.
yeah, what does the process feel like? Like, is it? I know you said that there's some numbing when it's happening, but like, what's the aftercare like? How painful is it? Like, what's the process?
So the numbing itself uses a needle, so that stings a little bit after the numbing goes in. So we're talking about, for the listeners who've went to the dentist, you feel the
Hmm.
stinging for a few seconds, right? And then after that
Hmm.
takes effect, you really don't feel anything else.
Hmm.
So the whole procedure is painless. And then there is some recovery. People get some bruising and swelling after.
Hmm.
It's not really like painful per se, not any different than if you just like bumped your knee and it was bruised. Like, it hurts, but it's not the
Yeah.
2 days later, it's not like debilitating, right? You just don't touch it. So it's that kind of thing. And then after about a week, everything's usually back to normal. We ask
Hmm.
people not to have sex for a week. Otherwise, there's not much. They to not go in a hot tub and steam room and stuff like that. But otherwise,
Hmm.
there's not like much aftercare or recovery or anything.
And is there any variation between circumcised or uncircumcised men?
Yes, there is. The procedure is more challenging for us to do if patients are uncircumcised. It's not
Okay.
impossible to do, but you do have to be good at the procedure to get a good result. And so that's something else. If you are uncircumcised, ask for some pictures and stuff like that to see because it can be more challenging. We do it, if you're uncircumcised, we do it in 2 visits. So we do about 2/3 of it on the first visit and 1/3 on the second visit. If you're circumcised, you can have it all done right away.
Okay.
The
A
anatomy
bit
is
more.
just different without going
Yeah.
into details.
Okay. Now, if someone was ambitious, asked for too much, and said, "Whoa, I need to have some taken out," is that possible?
Yeah, yeah, do that all the time.
Okay.
It's common for guys to be ambitious.
Hmm.
No, I shouldn't say all the time, but there's a lot of guys I can think of that
Hmm.
like they'll usually what happens is they get a ton and then it's like then they realize wait a second, having like an 8-inch circumference penis is actually not beneficial to my sex life.
Right. Like,
Yeah.
ouch.
So
Yeah.
I have one guy,
And it
like he's
looks like
funny.
distracting in their pants. Like, what?
Yeah, like
Nothing
it's
fits
just one
right.
guy who he's a funny guy and he was single and he just got out of control and then women would say like, dude, I'm not touching that, right? And then at
Right.
first he kind of took it as a compliment, right? He's like, "Oh, thanks," right? And then, but eventually, I think,
It's like, no, literally,
yeah,
I'm
you know
not
what?
touching
Maybe I
that.
should like,
Yeah. If I ever want to engage again, I gotta
Yeah.
do something about this. Yeah. How does it affect masturbation? Like, does it
Uh,
sensory wise, is it different?
I don't think so. I haven't heard any complaints about that. Actually,
And it
zero.
doesn't, it
I
doesn't,
never even thought about it.
okay, it doesn't accelerate like the draining of the acid, the hyaluronic acid or
No.
anything. It doesn't make
Well,
it.
to be clear, nothing's draining, right? Like the hyaluronic acid gets integrated into your tissue,
Okay.
so and it solidifies, right? So there's not like if you cut a hole in your penis, nothing would drain out. Not that we're cutting holes in
Just
people.
getting absorbed.
It just slowly gets absorbed over time.
Yeah. Okay. What about like a cock ring? Would that
Uh,
affect
I
anything?
mean, I think you might just need a bigger one.
Yeah. Okay. So yeah, anything that would like restrict it or it wouldn't matter. It's not going to affect.
Right, you just need something bigger. Like the whole it's really it gives you pretty natural results and
Mm-hmm.
there's not really a lot of downside. And so most of these things, I mean, you could like if you get to one of these absurd sizes, you could have condom problems, for example. Like I don't know if that
Yeah.
was the next question in your list there, but that's something that just came to mind. I would say that would be
Mm-hmm.
the most. But these are like the 8-inch guys that get out of
Right.
control, right? Not the
Right.
normal.
Yeah. What do you wish that more men understood on this topic?
I wish that more men knew that it was a thing, right?
Mm-hmm.
Like it's
That this
eventually
was
they will.
available?
Yeah, I
Mm-hmm.
mean, you can't it's like I can't put TV commercials on Super Bowl or anything, right? So
Right.
it's like it's kind of it's difficult to advertise. Social media bans us, and it's kind of like a weird. It's a double standard to be honest, right?
It
Because
really is. It's everywhere, and yet you can't say sex.
right, like you can, and the reason it's a double standard is because like breast implants, for example, have been completely mainstream, and if you try to put a YouTube video on like a YouTube advertisement on breast implants, it's not going to be a problem, right? But anytime you start talking about penis, it's like it gets banned and demoted and all kinds of stuff. So even though it shouldn't, right? It should be exactly the same.
Yeah, it's true that everything is a landmine. And of course, this episode will be explicit. We have to hit that
Right.
little marker.
For no
And then,
reason, right? Like
yeah, it's like we're just talking about body parts. What other, I guess, trends are you watching in this space?
it is becoming more common, right? So you're seeing
Mm-hmm.
more people kind of starting to do it. I think as far as trends go, there's, with people finding out about this procedure, I would say there's more people doing all kinds of other men's health things, right? Like they're all
Yeah.
kind of, they all get lumped into the same category as they probably should. So, like we kind of alluded to this at the beginning, you're doing, got men doing hormones and peptides and weight
Yeah.
loss and all those kind of things. So, that I would say that's the trend in general.
Yeah. I was listening to a lecture yesterday about men's hormone replacement and just sort of where that's going and when that's appropriate. And so I'm interested in that space too. So, and just general, men being more aware of appearance and longevity and all that is part of it. So, well, thank you for joining me for this conversation. You can learn more about Dr. and the Upsize Clinic at upsizematters.com. You can also follow the clinic on Instagram at Upsize Clinic. So we'll link all this in the notes. And if you've enjoyed this episode, please share it. That's how people find out. If you've got friends that would be interested in this topic, please share the episode. You can follow and rate this or review this episode if you found it helpful or informative. You can find out more at drjennkennedy.com. So please stay connected. So thank you so much. Appreciate you being on today.
Thanks for having me.
All right, so let's hit pause and then I'm going to go grab these notes and we'll do the next part. Okay, so here's the question. And then where's the intro?
You want the intro printed out like that too?
Yeah, intro.
No, 2 p.m.
Hey, can you just close the door? I'm just finishing up a podcast.
I can actually do that after without him. So I'm just going to do this part so I can let him go. Okay, all right.
Okay. Okay. By the way, that the other link I gave you, Gents Med, is
Mm-hmm.
our new kind of general men's health
Okay,
website. So I probably should have brought that up when we were talking about new trends, but I didn't think about it. But if you
that's okay.
click
I'll
the
link it
link,
in the yeah,
yeah.
I'll put that one in the show notes. Okay, so okay, so I'm gonna clip these and do this will be a separate episode. All right, you ready?
Yep.
Okay. All right. So welcome back. This is a VIP episode with Dr. Joel Pash. He was just on the regular website. Nope. Nope. Okay. We're going to start over. That wasn't a website. It wasn't. Hold on. Okay. So welcome back. This is a VIP episode with Dr. Joel Pash. He was just on the podcast and we did a longer episode, which you can find out about. He is the co-founder of the Upsize Clinic and he's the medical director of the San Francisco location. We talked about medical procedures and specifically about getting enhancement. And we're going to do a deeper dive now for this episode of questions that men are too embarrassed to ask. So, things that men secretly want to know but don't ask about penis size. So, what is the most common question that men ask once the door closes?
A lot of them want to know what the normal size is, kind of thing, if there's a normal. So I guess indirectly they're asking, like, is theirs bigger than normal, I guess, or smaller than normal?
I think that question is probably burning in their brains from like age 8.
Yeah, I mean, I guess that you could probably you could probably Google it, but I guess they figure they're in a doctor's office, and so I do have better information because I've seen so many in real life, for better or worse.
Mm-hmm. Yeah. Yeah. And I mean, we Google everything, but I think that there's something different when it's validated by a doctor who
Right.
literally does this for a living. So,
Exactly.
am I normal? Am I bigger or smaller? Yeah. Yeah. Okay. What size concerns are realistic versus unrealistic?
What size are you? Is your question, at what size do you have that would be a problem or not a problem? Or
Yeah, like how realistic, like when they want to go bigger, I mean, nobody wants to go smaller, right? They're coming in because everybody wants enhancement. So you had said in the podcast that some people come in wanting, you know, 4 or 5 inches of enhancement, which sounds crazy. What's realistic and what's a guide based on, I guess it's kind of their body size, like it's proportionate typically, but not necessarily.
well, it's usually dependent on where they're starting, right? If you're
Okay.
just in the sense that if you're starting at, like, just to give, absurd numbers, but if you're starting at 20 inches and you put 5 inches on, that's like nothing, right? But if you're starting at 5 inches and you put 5 inches on, that's double. So
Mm-hmm.
that's kind of the gist of it. In general, people, like the average person's, like, if we're talking about circumference, is 4 inches, and 2 inches is kind of like I would say the upper end of reasonable.
Enhancement.
Like,
Uh-huh.
so we
Okay.
say, like, add up to 2 inches. And so, like, most people could do that.
So the guy at home is like, wait a second, 4 inches is normal. So he's taking out like the flexible
Yeah.
measuring tape and he's
Seamstress
wrapping
tape.
this around. And he's wrapping
Right.
this around a flaccid penis or a
Yeah. So just
erect.
call it 5 if it's erect. But most
Okay.
guys in my office are, well, all guys are flaccid, right, when they come in.
Okay.
So
Well,
I just use
hopefully,
that.
but yeah. Yeah.
So
There's
sorry, go
hmm
ahead.
I said hopefully. They're probably scared,
Yeah.
so they're probably
Right.
in that
Exactly.
state. But yeah. Right. Okay. Do men usually underestimate or overestimate how they compare to average?
Oh, they always underestimate, right? Like,
Really?
I, they think, oh yeah, all guys think they're way smaller than average. Like,
Hmm.
this has actually happened a lot of times, like probably 10 times at this point, that I've had a guy come in and the conversation starts out with, like, doctor, I was born with a condition and it's really been a problem my whole life, and I'm smaller, and this whole thing, right? And I'm thinking,
Micro
I'm getting
penis.
ready for seeing some, like this big, and I feel bad for the guy, right? And almost all the time it's like that big, right? It's like they just have this complete like unreasonable like
I don't understand. I mean, I'm in my 50s, but like back in the day, we all had gym class and you had to shower together. Like you see the size. Like I don't understand. Like how
yeah.
could they not compare? And men see each other when they go to the bathroom. Like how do they not see that their
Well,
size
usually
is
we don't look
normal?
over when we're
You don't look
peeing.
over. You don't
In
look.
the airport, I'm just like checking everyone out both directions.
You don't look. I mean, or in the
No.
locker room or something. You don't look
Well, my
to
guess
see.
is they saw there was like one guy that was like a monster in the locker room, and then that's what they're fixating on, right?
Okay. I mean, I definitely compare my breasts to other women's breasts, but maybe that's a little easier to see because it's like obvious, you know? So
Yeah,
size wise,
exactly.
I can tell how I match up, but like
Yeah.
maybe penises are harder to spot.
Well, they
I don't
are,
know.
right? Because
A little
that's like a
more.
totally valid point, right? And that's like a huge difference in
Hmm.
probably why breast implants are like more common, right? Because for most guys that don't have this done, they
Hmm.
don't think about it because there's no comparison.
Yeah. So they come in thinking that they're significantly smaller.
Not
Interesting.
all
Okay.
guys. You just asked like
Yeah.
if which one is more common,
Yeah.
kind of.
Well, and again, this is also a selected self-selected group of people that are coming in for a procedure.
Right.
So,
Yeah.
yeah. Okay. What age groups are most concerned, would you say?
I would guess that the most concerned ages are younger than who I actually see in the office, right? Like I would think probably it's a 15 to 25-year-old that's actually concerned, but
Hmm.
we don't see those, right? Or at least, well, we certainly don't see 15-year-olds, and it's uncommon that we see anyone between the age of 18 and 25.
Hmm.
So, but yeah, probably that would be the age, of people that were concerned. I think by the time you get to 35 or whatever, you kind of know what you've got. At least, like you might kind of think you're smaller, but you also know deep down you're.
Well, and probably by that point, you've had sex with a few partners. And so you've had maybe a feedback loop that is,
I, it certainly you would know like okay, it's everything worked out fine, but I mean, guys have weird experiences probably too, right? And then
hmm,
can my guess is there something weird happened that they were unhappy about, and then they blame
yeah,
it on their penis size,
right.
even
That's
though that's
true.
unlikely to
Right.
be the thing.
Right. It's not
You
the
get
size,
broken
it's
up
more
with,
like
right?
what you
It's
do
like
with it.
way,
Right.
yeah, you're broken up with way easier to think that it's your penis size than it's your personality or your
Right.
job or, you know,
Right. Have concerns changed over the last decade?
I haven't been doing this for a decade, but I would
Hmm.
guess that it's the same because I've seen, like, in my hospital job, because I do work as an anesthesiologist still, I've
Hmm.
seen guys come in for urology procedures that had,
Hmm.
like, like Vaseline put in their penis in Vietnam or whatever. So it's like, that are, like,
What?
like an 80-year-old guy that went,
Uh-huh.
so that's just telling me that it existed back then too. It's just
Right.
they
There
didn't
was
have.
just more like crafty home
Yeah,
home MacGyver jobs back
yeah. I
then
mean,
trying
maybe
to
they
make
still do
the
that in
same thing
Vietnam. I
happen.
don't know, but
Yeah.
I've literally seen that. So I got to think. I think it's been a thing that's concerned people for all of human history.
Yeah. Hmm. Okay.
It's probably more you can do something about it now, right? So it's like people. Well, probably like in ancient Egypt, they just like I think they got like snake bites on their penis and stuff like that. Like there was
Right.
still things people were trying to do.
It's like the lip stuff that would blow your lips up, you know, it's like how do we enhance this? How do we make
Right.
it
So I
bigger?
do think it's an ongoing thing for forever. It's just there's like kind of better options now.
Yeah. Do you get testimonials? Like are there partners or are there patients that come back and, say this is like really been fabulous or like what do you hear?
Yeah, I'd get everything from a Google review to the wife coming in to the patient telling me right there. So, like, one of the more kind of objective feedbacks that I can remember I got is I had this OnlyFans performer, and he's kind of funny because he called himself the stunt cock. Like I don't think they even showed his face in the things that he was in.
Right.
I'm not sure, but I never watched it, but that was my impression. And he
Uh-huh.
said that this like actually increased his like marketability in his career. That
Uh-huh.
so he was getting
Well,
purely
yeah.
being, if you have a camera, all you see is the guy's dick. This was like incredibly beneficial for his career.
Right. Well, if that's, it's like you're a hand model, you got to
Right.
have good hands. It's like, well, yeah, that's his claim to fame.
How much more objective can you get than that? Right.
Yeah, I feel like I want to go, definitely want to go and look up your Google reviews now.
Yeah, there's like 150 of them or something. They're not easy to get.
Yeah, I mean, I know how hard it is for me to get a Google review as a sex therapist. I can't imagine yours. It's like nobody wants to put their name on that. Oh my
Yeah,
gosh,
my
that's
my
funny.
mom's a family therapist, and it's like I
Yeah,
keep telling her like you gotta get reviews because
yeah.
more people will come see you and stuff, and
But nobody
it's
wants
like
to own
she
that.
can't get anywhere. Like so, if she, but you have to be creative, right? You have to
Yeah,
encourage people to do it. You also have to ask
right,
the right people.
right.
So, like a guy that
It's like
works
just
for Google is not going to give you a Google review because
right, but it's so interesting because people that like data, people who want to read reviews to know that to screen you, that's before they get a procedure that's this personal, want to see reviews, but those same people don't want to review you
yeah, it's a
because it's too
little
personal.
in a way it's like unfair because one of the things we see is we'll have like plastic surgeons, for example, that are competitors.
Hmm.
And so they have an office that does plastic surgery, right? And so they'll
Yeah.
have 2,000 reviews, but it's all
Mm.
for women getting their lips injected and stuff like
Yeah.
that, which is way easier to review. And so, just from a purely marketing and uh,
Yeah.
competition perspective, it can be harder for us because I only
Yeah.
do one thing, right? So if I have 20 reviews, that's a lot.
Yeah. Well,
That's
because
like
it's,
a
yeah, it's just,
thousand people coming through the office.
yeah. What are the biggest misconceptions that men would carry into a consultation with you?
I just said they think it's going to be longer, right? Every guy,
Mm,
I have
hmm.
to explain
Not
that
the
when
consultation, but the penis,
so,
right? Right. That's the misconception that their penis could be longer, not the
oh, right,
consultation will
right,
be
right.
longer.
Yeah. Sorry. I thought, so yes, like again, like with certain guys, I could tell them anything and they don't hear it properly, right? It's like,
Mhm.
okay,
Yeah.
you're just so you know, like you're only getting, it's going to be thickness, not really length. It's like, okay, yeah, but it's going to be a little bit of length, right? No, it's like, no, it's not going to be any length, right? And then
Right.
sometimes you'll get that guy come back and say, Doc, it didn't make it longer, right? And it's like, well, I told you 3 times in 3 different ways that it wasn't going to make it longer. So, you get that sometimes.
Yeah. Yeah. They hear what they want to hear. That
Right.
makes sense.
It's medicine, right?
Mm-hmm. Yep. Anything else that you feel like you wish, like, this is the golden, like, ticket, that you could tell people?
Yeah. Well, for anyone that's watching or listening, you might have been thinking the whole time, like, oh, this is only for weird people, or this is, I don't need this, or whatever. And I get that because you probably don't know anyone that's had it done, but you probably do know someone that's had it done. They're just not telling you about it. So, what I
Yeah.
can say is if you were to spend time in my office all the time, like I do, you would see that it's like a totally normal group of people that see us. Like I have high school teachers, pediatricians, lawyers, auto mechanics, OnlyFans performers, paralegals, just everything. So other dick enlargement doctors, tech billionaires is very common in the Bay Area. So really everyone, and you so people just don't think that it's a weird thing or abnormal. People get it done, they just don't tell you about it
Yep.
because that's the way guys work, right? Like if I told my friends that I got my penis enlarged, they would immediately turn back and say, "Oh, Pash has a small penis. He needed to get it enlarged," right? Like
Yeah.
It's just how
Yeah.
guys are, but like women aren't really like that.
Yeah.
So yeah, just
Yeah,
know
that's
that
interesting, right? It's like, do you not get credit for like having it then if it's like enhanced?
it it depends on your like. First of all, most guys probably don't tell their friends. I
For that
kind of
reason.
funny actually because I'll tell you a story. Like I have a friend that so I was training a doctor a while ago, and we needed one more patient to give him appropriate training. And so I have this group of friends that I grew up with, and we have like a chat group on WhatsApp or whatever. And so I just said, okay, like, does any of you guys want it done? Right. And they all said no, except for one guy said
Oh.
yes. So I was like, okay, come in, we'll do it. And they still make fun of him, but they're like not really making fun of him because they know I did it and they know that he has a bigger penis now, but it's still a joke that guys kind of do, right? So
Uh-huh. Yeah. I
whereas
was
like I
wondering if
don't
you
think
were going to
women
say
are
that they
like that.
maybe texted you off the chat and said, "Well, I'll do it, but don't tell anybody." That's what I
Exactly.
thought you were
Like
going
no,
to
he just
say.
owned it. He didn't care. We've all known each
Right.
other since we were little
Right.
kids. But
Yeah. That's funny.
that so he was cool enough that he just opened himself up for the
Yeah.
jokes or whatever. But I just think that's the
hmm
way guys are, at least my group of
Yeah.
friends.
Yeah. Well, great. Well, I appreciate you giving us this extra time. Tell us the website where people can find you.
So you can find me on upsizematters.com. And then we have a couple other sites. We have one called urosculpt.com, UROSCULPT, where we do training for physicians and physician assistants and nurse practitioners. And then lastly, we have a site called GentsMed, GentsMed.com. And on that site, you'll find all kinds of other men's health treatments like TRT and weight loss and peptides and all that.
Great. All right. So kind of the whole gamut. Well, thank you so
Yep.
much. I really appreciate you coming on today.
Thanks for having me. It was fun.
Thanks for listening to The Pleasure Project. If today's episode resonated with you, take a moment and please leave a review of the episode, or better yet, send it to someone who would appreciate the conversation. It really helps more people find the show. If you want to go deeper, you can explore my courses, workshops, articles, and educational resources at drjenkennedy.com. I also share the relationship insights, clips from the podcast, clinician perspectives, conversations around sex, intimacy, and emotional connection across social media. So come connect with me on Instagram, TikTok, YouTube, LinkedIn at Dr. Jenn Kennedy. Thanks for being here and see you next time.